dose-response curve. Look at this graph. Which drug has largest effect? A, B, C, or D? This is a graded dose-response curve for 4 drugs, illustrating different pharmacology potency and different maximal efficacy. So, before we could judge which drug has largest effect, we should know what is graded dose-response curve, what is potency, what is maximal efficacy. Dose-response curve. Graded dose-response curve is a graph of increasing response to increasing drug or dose. What is meaning? Look at this graph. The abscissa is drug concentration. The ordinate is drug effect. Along the drug concentration increase, the drug effect increase proportionally. The relation between the dose and response, we call it dose-response relation or concentration-response relation. The curve, we call it dose-response curve or concentration-response curve. So, graded dose-response curve is a graph of increasing response to increasing drug or dose. What is graded? We will discuss it later. Dose-response curve. Even in inter-animal or patients, response to the dose of the drug usually increase in direct proportion to dose. As doses increase, however, the response increment diminishes. Finally, doses may be reached at which no further increase in response can be achieved. In idealized or vitreous system, the relation between the drug concentration and effect is described by a hyperbolic curve, according to the following equation. Here is equation. The curve is shaped like this. What is meaning? Look at this curve. It's a graded dose-response curve. It's a hyperbolic curve. In the low dose, drug response increase in direct proportion to dose. In the lower dose, drug response increase in direct proportion to dose. As dose increase, the response increment decrease. As dose increase, the response increment decrease. Finally, no further increased response can be achieved. The curve shaped like hyperbolic curve. The curve shaped like hyperbolic curve. It's a hyperbolic curve. Here is equation. E is effect. C is concentration. Emax is a maximal effect. EC50 is the concentration of drug that produce 50% of maximal effect. Produce 50% of effect is concentration. We call it EC50. Look at this graph. It's a graded dose-response curve. We could plot 2 kinds of graded dose-response curve. One is hyperbolic shape. The other is sigmoid. If the scale of abscissa is concentration, we could plot hyperbolic shape curve. If scale of abscissa change into logarithmic concentration, we could plot sigmoid curve. Clinically, sigmoid curve is more commonly used. Look at this graph. A is the relation between drug concentration and drug effect. Drug concentration, drug effect. B is the relation between drug concentration and receptor-bound drug. Drug concentration, drug receptor-bound drug. We have then EC50 is the concentration of the drug that produces 50% of maximal effect. What is EC90? EC90 is the concentration of the drug that produces 90% of maximal effect. What is EC5? EC5 is the concentration of the drug that produces 5% of maximal effect. Okay. KD. KD is the concentration of drug that 50% of receptor was occupied. 50% of the receptor was occupied. Its concentration, we call it Kd. In fact, EC50 equal to Kd.